Hello guys, so today topic is dental ceramics. Starting with the history of ceramics, ceramics were the first artificial material to be made by the man. History of the ceramics can be dated back to 2300 BC. Ceramics is taken for the Greek word keramos, which means burnt off or the poetry. First ceramics used in the pottery were called whiteware because of the white color during its baking. Now this is the very important line, or you can say it is a very important point, that Alexis in 1774 thought about using the ceramic household utensil material as a restorative material due to its strength and known porous in nature, which led to the first porcelain denture. In year 1940, vacuum firing of the porcelain has been done. In 1950, metal ceramics restoration work came into consideration or were introduced. In early 1990s, aluminous porcelain jacket crowns was introduced, which leads to all ceramic restorations. Coming on to the classification of ceramics. Number 1, by content. It is irregular feldspar-Ex porcelain, aluminous porcelain, lucite reinforced porcelain, glass infiltrated alumina, and glass infiltrated spinel. Classification by use. It could be artificial teeth, coarse ceramic, veneer ceramics. Classification by processing method. It can be processed either by sintering, by casting, or by machining. Classification according to their firing temperature. It will be high fusing, that is 1300 degrees Celsius, medium fusing, that will range from 1100 to 1300 degrees Celsius, low fusing, that range from 850 to 1100 degrees Celsius, and ultra low fusing, which ranges less than 850 degrees Celsius. Classification by method of firing. It can be air fired, vacuum fired, or diffusible gas. By the area of application, it can be used in core porcelain, body dentine porcelain, gingival dentine porcelain, or incisal enamel. Coming on to the composition of ceramics. Number 1 is the feldspar. Feldspar, when mixed with the metal oxides and fired, it forms a glass phase that is able to soften and flow slightly. This softening of glass allows the porcelain particle to coalesce together. This is called sintering. I hope the sintering is clear to you. So it is seen in the concentration of 75 to 85%. Coming on to the clay or the kaolin, it acts as a binder. When mixed with the water, it forms a sticky mass which allows the unfired porcelain to be easily worked and molded. On heating, it reacts with the feldspar and gives rigidity. Its color is white and it reduces translucency. So it is added only in the concentration of 4 to 5%. Please remember the concentrations, these are very important. Coming on to the next composition, that is quartz. It imparts more strength, firmness, and translucency. It gives stability of mass during heating by providing a framework which ranges from 13 to 14%. Coming on to the glazes, it decreases the pores on the surface of fired porcelain. This increases the strength How? By decreasing the crack propagation. If the glaze is removed by grinding, the transfer strength is half of the glazed porcelain. If you remove the glaze by grinding, so the transfer strength of this is half of your glazed porcelain. So glazes can be self-glazing, that is external glaze layer is not applied here. The completed restoration is subjected to glazing here. Second is the add-on glazes. External glaze layer is applied here. They are uncolored glasses whose fusing temperature is lowered by addition of glass modifiers. The disadvantages are that they have the low chemical durability, difficulty to apply evenly, and difficulty to get exact surface characteristics. Coming on to the coloring agents. The coloring pigments are produced by fusing metallic oxides together with the fine glass and feldspar. Example, the iron nickel oxide, that is brown in color, copper oxide, that is green in color, titanium oxide, that is yellowish brown in color, and cobalt oxide, that is blue in color. These are the coloring agents which are used. Opacifying agents. The opacifying agents consist of a metal oxide ground to a very fine particle size. Example, cerium oxide, titanium oxide, zirconium oxide, which are most popular, which are used as an opacifying agents. Coming on to the stains, this powder is mixed with the water and the wet mix is then applied with a brush to the surface of porcelain before glazing. See, you have to apply this before the process of glazing. Internal staining is preferred as it gives lifelike results and prevents direct damage to the stains by surrounding environment. Coming on to the glass former. Glass former are silica, that are the crystalline quartz, the crystalline cristobalate, crystalline tridymite, and non-crystalline fused silica. See, the ceramic has a number of composition. They have a number of constituents in the composition. So you have to remember these compositions with each and every constituent of it. So coming on to the glass modifiers. Example are potassium oxide, sodium oxide, calcium oxide. These are used as a glass modifiers. They act as a fluxes by lowering the softening temperature of a glass. Coming on to the intermediate oxides, the glass modifiers reduce the viscosity of porcelain. It needs a very high viscosity as well as low firing temperature. So basically this is the intermediate oxide. This is done by the addition of Al2O3 aluminium oxide and B2O3, that is barium oxide. Coming on to the general properties of ceramic. First is the biological property, that it has an excellent biocompatibility. So your ceramics have a greatest, or you can say excellent biocompatibility. They are very biocompatible with tissues. Chemical properties, it resists attacks by the chemicals. They have to be roughened by etching with the HF. I have already told you that HF 9.6% of hydrofluoric acids are used, or you can also sandblast it to improve the retention of the cement to the internal surface of the restoration. Coming on to the mechanical properties, it has a low tensile strength, it exhibits little plastic deformation and have a good compressive strength. So compressive strength, it ranges with 50,000 pound per square inch. Tensile strength is 5,000 pounds per square inch. and shear strength is 16,000 per square inch, and elastic of modulus is 10 into 10 raised to the power 6 per square inch. Noob hardness is 460. Your coefficient of thermal expansion is 12 into 10 raised to power minus 6 pound per square inch. Coming on to the thermal properties, they have an insulating capacity. Optical properties, they have a good optical properties as they are translucent because of the absence of free electrons. Important point. Coming on to the fabrication of the ceramic restoration. First is the condensation of the porcelain. So in this, liquid plus powder leads. First what you have to do, you just mix the powder in the liquid and condense it. The process of packing the powder particle together and removing the liquid binder is known as condensation. The main objective of building porcelain is to achieve the maximum packing density of the powder so as to reduce the porosity and the shrinkage during the firing. Now, types of binder. First is the distilled water, propyl glycol and alcohol or formaldehyde. So in the distilled water, it is the most popular binder. Propylene glycol, it is used in the alumina core buildup. Alcohol or formaldehyde based liquids, it is used for your coal buildups. Building up of porcelain. In this, the powder is mixed on a glass slab. Mix should not be overstirred to avoid the air bubbles. High room temperature and dry atmosphere avoided as powder can dry out rapidly, due to which air spaces are created in a powder bed. So in this, what you have to avoid is, first, the mix should not be overstirred. You have to avoid the overstirred mix. Second, you have to avoid the high room temperature and the dry atmosphere. Why? Because it creates the bubbles. Methods of condensation. First is the vibration method. In this, mild vibrations are used to pack wet powder. Second is the spatulation. A small spatula is used to apply and smoothen the wet porcelain. This brings excess water to the surface. Dry brush technique. Dry powder is placed with a brush. Water is drawn towards the dry powder and the wet particles are pulled together. Next is the ultrasonic. Mild vibrations are given electrically. Coming on to the factors that determines the efficiency of the condensation. First is the size of the powder particle. If only one size particle are used, then you have 45% of the voids. If you are using two size particle, you have 25% of void. If you are using three size of particles, you have 22% of the voids. So system that uses three size particle is called gap grading system. It is very important for your exam point of view as an MCQ, that the three size particle is also called as gap grading system. Second, according to the shape of the powder particles, the round particles give better packing than angular particle. These are the various enamel dentine porcelain powders. Can you see this? It is opaque. A2 shade is opaque, then A2 is opaque in dentine, A2 is dentine, and1 is in the enamel. So what you have to do is, you just mix the liquid to the powder. Firing of the dental porcelain. During firing, the glass particles soften at their contact areas and fuse together. This is known as sintering. Sintering is a very important topic. So temperature is raised gradually to the desired one to allow the air and the gas bubbles to escape via the grain boundaries. So the powder becomes dense and it shrinks. Your powder becomes dense and your powder gets shrinked. What are the changes you observed during the firing? Number 1 is the loss of the water which was added to the powder. Free and combined water is lost till a temperature of 480 degrees Celsius. Second, with the further rise in temperature, your particles starts fusing together. The process is also called as sintering. As you know, I already told you in the previous slide about the sintering. So third is the firing shrinkage, which decreases the volume. In low fusing porcelain, it decreases the volume by 32%. In high fusing porcelain, it decreases the volume by 28%. Next is the glazing. So glazing occurs at the temperature between 965 to 165 degrees Celsius. Coming on to the stages of firing: low basic, medium basic and high basic. So in low basic, the surface of the porcelain is porous. Porcelain has started to soften. Shrinkage will be minimal and the fired body is extremely weak and friable. So it lacks translucency and glaze. Coming on to medium basic, the surface will be slightly porous in this. The flow of the glass grains will have increased. Definite shrinkage would have happened and lacks translucency and glaze. Coming on to the high basic, porcelain has smooth surface with a shine and shrinkage in this is complete. Firing technique: the temperature method, temperature time method. What are the medias for firing? Air, vacuum and diffusible gas. Coming on to the air firing, all porcelain mixes have some amount of porosity in them. So once in an air furnace, the furnace atmosphere occupies the voids. More chances of porosity in air firing. Important point. Vacuum firing, which as you all know, it reduces the porosity. Vacuum removes the air from the interstitial spaces before surface sealing occurs. So vacuum is then removed when the porcelain is in hot zone of furnace, and then when the air gets in, it exerts a compressive effect on the surface which compresses the internal void 1/10th of its original size. Very important point. Coming on to diffusible gas firing, air is driven out of the porcelain powder and diffusible gases like helium, hydrogen are used. With these gases, interstitial spaces do not enlarge under the increasing temperature but decrease in size or disappear. This is because the gases diffuse outwards through the porcelain or actually dissolves in the porcelain. This is called your diffusible gas firing. Coming on to the glazing. Glazing seals the open pores on the surface, gives the polish and the smoothness to the surface. Overglaze, external glaze layer has to be applied. These are ceramic powders containing more amount of glass modifiers, thus lowering the fusing temperature. Self-glaze, all the constituents on the surface are melted to form a molten mass of about 25 micrometer of its thickness. Please keep this in mind. And what is the procedure? Introduce into the muffle entrance for 1 minute. Place on firing platform at 100 degrees Celsius for 2 minutes. Hold for 940 degrees Celsius for 2 minutes and air fire. This is the procedure. So this is the various ceramic stains we are using. Now coming on to the method of strengthening ceramics. First, method of strengthening brittle material. In this, development of the residual compressive stresses. Strengthening is gained by virtue of the fact that these residual stresses must first be negated by developing tensile stresses before any net tensile strength develops. For example, if net compressive stress within a surface of ceramic is 40 megapascal and the total normal tensile strength of the stress-free ceramics is 60 megapascal, it would take a total induced tensile strength, that is 60 and 40 will lead to that is 100 milliampere to cause the fracture of the material. So it get combined, your normal tensile strength and your compressive strength of the surface of the ceramic and your stress-free ceramic, it gets total out, which cause the fracture of the material. Coming on to the ion exchange, chemical tempering, sophisticated and effective methods of introducing the residual compressive stresses into the surface of ceramics. This process involves the change of larger potassium ion. Remember potassium ions. For the smaller sodium ions, a common constituent of a variety of glasses. What? The potassium ion, larger the potassium ion and the smaller is the sodium ions. If a sodium containing glass article is placed in a bath of molten potassium nitrate, so potassium in the bath exchanges place with a few sodium ions, as similar as this, that the process involves the exchange of larger potassium ions and with the smaller sodium ions. Same way. So potassium ion is about 35% larger than that of sodium ions. The squeezing of potassium in the place formerly occupied by sodium ions, which creates a large residual compressive strength, around 700 megapascal, in the surface of the glass subjected to this effect, thereby producing pronounced strengthening. Ceramics like die-core, alumina core, some conventional feldspathic porcelain with the high potash content are not amenable to ion exchange. After ion exchange, coming on to a thermal tempering that creates the residual surface compressive stresses by rapidly cooling, or you can say quenching, the surface of the object while it is hot and in softened, that is in the molten state. This rapid cooling produces a skin of rigid glass surrounding a soft core. As the molten core solidified, it tends to shrink, but outer skin remains rigid. In the core, it gets solidified. In the inner parts, it gets solidified, but your outer skin remain in a rigid form. So this pull of solidifying molten core as it shrinks creates a residual tensile stresses in the core and residual compressive stresses within the outer surface. After this, coming on to thermal compatibility, thermal expansion and the contraction of porcelain and alloy cannot be precisely met. Instead, should be adjusted in such a way that during cool down period after firing, the transient and the residual stresses are sufficiently low and properly directed, so that the porcelain is not subjected to intermediate or direct failure. Ideally, it should be in a slight compression in final restoration, achieved by selecting alloy that contracts slightly more than porcelain on cooling to the room temperature. Next is the disruption of the crack propagation. This involves the reinforcement of the ceramic with a dispersed phase of the different material that is capable of hindering a crack from the propagation through the material that relies on. relies on the toughness of the particle, which absorbs the energy from the crack and deplete its driving force for the propagation. Crystal structure change under stress is absorb energy from the crack. Coming on to dispersion of crystalline phase. When a tough crystalline material such as the alumina in a particulate form is added to the glass, what happens is the glass is roughened and strengthened because crack cannot penetrate the alumina particle as easily as a glass. So basically the crystalline phase is your toughest phase, because in this you are not using the glass, you are using the crystalline material, that is alumina. So when you added the alumina, what it does is it makes the glass roughened and strengthened, and the pores and the crack cannot penetrate the alumina particle. So this led to development of aluminous, porcelain and die-core glass ceramic. Cast glass crown subjects to heat treatment forms micron size mica crystal when subject to high tensile stress. These crystals disrupt the crack propagation. Please go through this slide once, it is very important points. Coming on to the transformation toughening, it involves the incorporation of a crystalline material that is capable of undergoing a change in a crystal structure. When placed under stress, it is partially stabilized zirconia, that is PSZ, partially stabilized zirconia. Energy required for transformation of partially stabilized zirconia is taken from energy required for crack to propagate. The disadvantage of this is your partially stabilized zirconia has the higher refractive index than the surrounding glass. The particles scatter light as it passes through the bulk of porcelain. So this scattering produces an unaesthetic opacifying effect. Coming on to the design of dental restoration involving ceramics. In this, first is minimizing tensile strength. In this, your conventional PGCs are contraindicated for post. Teeth because occlusal surface can subject them to large tensile stresses, which are usually concentrated near the interior surface of the crown. I hope it is clear to you. It is very important topic. So, according to the design, it is your minimizing tensile strength. Coming on to this, even interior teeth with a great overwhite and moderate overjet. In this, PJCs can be subjected to the high stresses. The metal ceramic crowns use as strong yet ductile coping as foundation of the restoration to which porcelain is fused. It minimizes the flexure of porcelain associated with the tensile stresses. Second, reducing the stress razors. What is the definition? They are the discontinuities in the ceramic and other brittle structure that cause stress concentration. In this, abrupt changes in the shape or the thickness of the ceramic contour, creases or the fold of the platinum foil substrate, the sharp line angles of the preparation, large changes in the porcelain thickness, a small stray porcelain particle along internal margins, occlusion if not adjusted properly contact point rather than areas greatly increase the localized stress. These should be avoided. So, coming on to the metal ceramic restorations. Porcelain powder for the metal ceramic restoration. The greater quantity of feldspar is required to increase the thermal expansion to a level compatible with the metal coping. Increased amount of metallic oxide as an opacifier to conceal the underlying metal. Coming on to the bonding mechanism between the ceramic and the metal. These are the mechanical entrapment, the compressive forces, van der Waals forces, chemical bonding. In this, the chromic oxide with the base metal, tin oxide, and the iridium oxide with the noble metals. Advantages: metal reinforcement, better fracture resistance, better marginal fit due to metal frame. Disadvantages: less aesthetic, as you all know. Margins may appear dark due to metal. Bond failure in metal ceramics by O'Brien. So, between metal and the porcelain, between metal oxide and porcelain, between metal and metal oxide, between metal oxide and metal oxide. These are the bond failure which mainly occur in the metal ceramics. So, types of bond failure in the metal ceramic. This is your ceramic part, this is your oxide part, this is your metal part. So, can you see this, the failure in this? You can appreciate in this part. This is the porcelain interaction metal. Number 1, you can see the fracture over here. This is your metal part, this is your interaction part, this is your porcelain part. Number 1, the failure. Can you see this, the failure? It will not get interact with each other. In this, it will not get interact. Try to, but not get interact with each other. In this, not interacted. So there is a failure of the bond to porcelain to metal. So advances in the metal ceramics. Colorless porcelain. This was introduced to overcome the disadvantage of metal being exposed and giving unaesthetic appearance. Here, the color of the metal is absent in the gingival area. They can be made up of platinum foil on a refractory die. Coming on to the all ceramics. Classification: conventional powder and the slurry ceramics, that are high cream, alumina reinforced, optic HSP, that is lucite reinforced, Duracem, that is IFC. So second is the castable or ceramic restoration, that is dyed core and cerapper. Pressable or ceramic restoration, IPS Empress, and your optic pressable ceramic. Infiltrated all ceramic restoration, that in ceram. Machinable all ceramic restoration, that is CAD/CAM, copy milling, and erosion technique. First, coming on to the porcelain jacket crown. They were very brittle and fractured easily. They were called as half-moon fracture. They also showed poor marginal adaptation. Processing: your porcelain jacket crowns are made using the platinum foil technique. A platinum foil is first adapted to the die. The foil acts as the matrix and support the porcelain during firing. Aluminous porcelain jacket crowns. Meckling and Hughes in 1965 introduced porcelain jacket crowns with an aluminous cores to improve the strength of the traditional porcelain jacket crowns. Increased content of the alumina, that is from within 40 to 50% in the core, strengthened the porcelain by interruption of the crack propagation. So these are the alumina particle. Can you see this particle? These are embedded in the glass metric composite. Can you see this? The large particle, these are the alumina particles. These are the cracks. So factors affecting the strength and the opacity of aluminous porcelain: finer the grain, greater the strength. Coarse grains are less opaque, so there is a compromise between strength and the aesthetic. Why? Because strength is greater but it is less opaque, so there is a compromise between the strength and the aesthetics. So average grain size to be 25 mm, which allows light transmission of at least 15%. Size of the glass powder is less than 40 mm, as this size powder softens and flows more easily around the alumina grains, producing high center densities. Rounded grains are preferred over the angular ones, since angular ones interfere with the flow of glass phase, producing the flaws around the grains and reducing the strength. It reduces the strength. Alumina concentration should be around 40 to 50% by weight. Concentrations higher than this would prevent the complete flow and wetting the glass matrix. Properties are compressive strength, that is 3,16,000 pound per square inch, transfer strength 20,000 per square inch, shear strength 21,000 per square inch, and modulus of rupture is 15,000 per square inch. Uses: due to the reduced translucency, aluminous porcelain is limited to forming a refractory framework capable of supporting weaker, more translucent dentine and enamel porcelains. Only these two types of all ceramic restorations are called porcelain jacket crown. The rest of them called ceramic jacket crowns or the glass ceramic crowns. Coming on to the lucite reinforced porcelain. Optech HSP. Lucite were used as reinforcing fillers because of their increased tensile strength. Lucite is potassium aluminosilicate crystals. The processing is lucite and the glassy components are fused together during the baking process at 1020 degrees Celsius. Then build-up condensation condensation of all are done by the powder and the water slurry technique. Lucite porcelain can be used for both body and incisal portions, as lucite does not need employment of the translucent porcelain. Lucite crystals amount to 50.6% by weight of Optech HSP. These are the lucite crystals. Can you see this? Bigger than alumina particles, alumina crystals. Smaller, 10 micrometer. Advantages are lack of metal and opaque substructure, good translucency, moderate flexure strength, and the disadvantages are potential fracture of posterior teeth, increased lucite content which leads to the high in vitro wear of the teeth. Castable ceramic or the glass ceramics. A metal stable glass is first formed after casting. During subsequent heat treatment, controlled crystallization occurs with the nucleation and growth of internal stresses. This conversion process of a glass to a partially crystalline glass is called as ceramming. Thus, a glass ceramic is a multi-phase solid containing a residual glass phase with a finely dispersed crystalline phase. It decreases the crack propagation. Dichore, it is composed of silicon oxide, your magnesium oxide, your potassium oxide, and your magnesium fluoride. So your aluminium oxide and zirconium oxide added in this for the durability. Fluorescing agent for aesthetic. Fluoride act as a nucleating agent and improve fluidity of the molten gas. After ceramming, material is 55% crystalline. Fabrication. Wax pattern made, invested in a phosphate bonded refractory material. Molten glass with range of temperature 1358 degrees Celsius is then cast to heated mold after dewaxing. Cast restoration is then freed from the investment, covered by protective embedment material and made to ceramming. It takes 114 minutes to reach the casting of the temperature of about 1075 degrees Celsius and maintain this for 1 hour. Embedment tray is then removed. Your ceramic glass is then built up with the enamel and dentine. Aesthetic due to their translucency, which matches that of the natural tooth enamel. It made entirely of one material, and so no opaque substructure. It gives a chameleon effect in which the restoration acquires the part of color from adjacent teeth. Precision fit is seen with die core. Durability. It can withstand 20 years of the toothbrush abrasion without any change. Very important. Tissue acceptance. It is high to periodontal tissue. There is no need for opaque porcelain to cover the metal substrate. Absence of opaque layer helps the clinician to obtain the natural translucency in the gingival area. Little discomfort occurs on contact with the hot and the cold food because of the extreme low thermal conductivity. Very important slide and very important points. Advantages: excellent margin fit, high strength, surface hardness and occlusure were similar to enamel, can reproduce wax pattern precisely with the lost wax technique. Who gave the lost wax technique? Very commonly asked question. I have told you number of times. So Dr. Taggart gives the lost wax technique. It has the excellent aesthetics, inherent resistance to plaque accumulation. Disadvantages are chance of losing the low fusing feldspathic shading porcelain, which have been applied for good color matching. Coming on to the castable apatite ceramic, that is cerapearl. It is developed by Hobo and Bioceram group as CaOP2O5 and MgOSiO2 glass ceramic. This material once cast has an amorphous structure, but when subjected to ceramming form crystalline oxyleptate, that is Ca10PO460. Compared to the normal enamel, crystals of cerapearl show irregular arrangement. This difference in arrangement accounts for its increased mechanical properties. So CaOP2O5 are the main ingredient essential for formation of hydroxyapatite crystal. Coming on to the pressable ceramics. These are also called as injection molded glass ceramic lucid reinforced hot pressed glass ceramic. This system was introduced by Volvind et al. In 1989. Came as IPS Empress and Optic OPC. So it is less susceptible to fracture than conventional porcelain, and it shows lower compressive strength than that of metal ceramics. IPS Empress. This is also used as the lost weight technique, but here the material is pressed into the mold under the pressure and not centrifugally driven. Very important point. Wax pattern is first fabricated, then invested in the phosphate bonded investment material. All in this, these are investment in the phosphate bonded. After burnout, the ceramic ingot is placed under the alumina plunger. The entire assembly is heated at 1150 degrees Celsius. The plunger presses the molten ceramic into the mold. Final shade of restoration is adjusted by veining. With the lost wax technique, the shrinkage is reduced, very important, as only shrinkage occurs during cooling, and it can be controlled by using an investment with the appropriate expansion. Advantages: lack of metal and opaque ceramic core, moderate flexure strength, excellent fit, good aesthetic. Disadvantages are potential for fracture in the posterior teeth, need for special equipment. Coming on to the infiltrable ceramics. In ceram, strength of the alumina reinforced porcelain is limited by the introduction of porosity. To overcome this disadvantage, the infiltrable ceramic was introduced. It is supplied in the two components: the alumina oxide powder, which is porous substrate, and second is the low viscosity glass, which is infiltrated at the high temperature to make a 3D network. So the alumina powder and the water is mixed to make a suspension or the slurry that is called slip. Slip is painted on an absorbent refractory dye. The dye draws the water from the slurry and deposits a layer of solid alumina on the surface, which is then sintered at 1120 degrees Celsius for 10 hours to produce an opaque porous core. In the second phase, the glass infiltration material of the right shade is applied to the core and fired at 1100, that is 1100 degrees Celsius for 3 to 5 hours. The molten glass infiltrates residual pores by the capillary action, leading to the dense composite structure, which has 20 times the strength of the core material. Very important point. Final infiltrated core has 85% of the crystalline component, which gives 3 times increase in the flexure strength that compared to the other ceramic. The core is then veneered with the dentine and the enamel. Feldspar-Ex porcelain using conventional powder and the water slurry. Now, alumina is 99.56% by weight. Infiltration glass is lanthanum aluminosilicate with the small amounts of sodium and calcium. It has the highest flexure strength among all the ceramics. Disadvantage: high opacity, so used only for construction of high strength substructures. In ceram spinel, here spinel is used instead of alumina. The spinel is the composition containing the alumina and the manganese oxide, that is MgAl2O4. Since a low refractive index of the spinel compared to the alumina, the translucency of the ceramic is improved, but it has low fracture strength. Properties are: glass infiltration that eliminates the residual porosity, your flexure strength, that is 450 megapascal, tensile strength 3 to 4 times more than that of conventional porcelain. Coming on to the machinable ceramics. From 1988, machined ceramic came into being. There are two major types of the fabrication done in this technique, that is the analogous system and the digital system. In analogous system, copy milling or the grinding technique, erosive technique, and in the digital CAD/CAM technology. Coming on to the CAD/CAM restorations. Stages in the CAD/CAM fabrication is computerized surface digitization, computer aided design, that is CAD, computer assisted manufacturing, that is CAM, computer aided aesthetic, computer aided finishing. Moraman and the Brandestini was the first ones to use the CAD/CAM device in 1988. The first model which came was called the Serec 1, that came in 1988, which cannot be prepared. The occlusion anatomy of the preparation, camera not good. Excuse me. CEREC 2 in 1994, they had better image processing system. It also has a cylindrical diamond stone which is able to finish off the undercuts at the buccal extensions. Occlusal anatomy could be produced here. The disadvantages are has many parts, so the operator has to move around. Impression not good, marginal fit not good. Coming on the CEREC 3, different parts could be magnified in detail, more final detail noticed, and disadvantages are not capable of producing margins of restorations. CEREC 3D is good marginal fit, contacts can be chosen, 3D movable camera. Cavity consideration for CAD/CAM. No convexity should be present on the pulpal and the gingival walls. The occlusal step should be 1.5 to 2 mm in depth, very important for your exam point of view. Isthmus should be at least 1.5 mm wide to decrease the possibility of the fracture of the restoration. Buccal and the lingual walls of the preparation may converge towards the occlusal surface. This feature is unique to CEREC system as it can automatically block out any undercut during the optical impression. Very important slide. Axial wall should be straight and not follow the convex contour of the proximal surface of the tooth. No cavo surface or the marginal bevel should be given. Various ingots used for the machinable ceramics are the CEREC White Block Mark I. Its composition strength are similar to that of feldspar-Ex porcelain. It is used first with the CEREC system. CEREC White Blocks Mark II. High strength feldspar-Ex porcelain with grain size finer than that of Mark I composition. Less abrasive wear of the opposing teeth. Dicore MGC, glass ceramic with the fluorosilicate mica crystal in a glass matrix. Fracture strength higher than castable dicore and CEREC systems. Softer and less abrasive than CEREC White Blocks Mark I, but not as much as the CEREC White Blocks Mark II. Coming on to the advances in the ceramic restorations. Number 1 is the Procera. Procera concept used CAD/CAM. It uses the CAD/CAM technique, has the densely sintered aluminum oxide coping and low fusing all ceramic winnowing porcelain. Procedure is scanner is used to take impression of the teeth. The scanner probe is made to contact the surface of the die as it revolves around the vertical axis. By the end of it, around 50,000 lines will be mapped, and once it's scanned, the Procera software will design the restoration. Then it is sent to the Procera lab in the Sweden via modem for making the ceramic. The ceramic restoration will be couriered back within 3 weeks. Porcelain. So the ceramic restoration will be couriered back in 3 weeks. So this is all about your dental ceramics. I have some important question which was previously being asked in your AIMS and AIPG exam. So your first MCQ is, the chemical tempering in porcelain is done to interrupt crack propagation by inducing a residual compressive strength. It is not an MCQ, it is an important point. So first MCQ is, the opacity in the ceramics is achieved by adding. Your answer is titanium oxide. And second is, pyroplastic flow of the porcelain is due to. Your answer is high temperature during glazing. It was asked in your AIPG exam. In porcelain, metal elements are embedded in matrix of. Your answer is glass. Also, there was this is a question in your AIPG. This was a question. So, phenomena in which the porcelain appears next MCQ. Phenomena in which the porcelain appears different under varying light condition is known as metamerism. was asked in your APG as well as in your AIMS exam. Next MCQ is porcelain is best fired under, your answer is under air compression. Next MCQ, machinable glass ceramic is, your answer is decor MGC. Flux used in the dental ceramic is, answer is boric acid. Next MCQ, opaque porcelain contains opacifiers like zirconium and titanium oxide. Next MCQ, decor restoration is a castable ceramic. Next MCQ, porcelain binds to metal in porcelain fused metal crown by, your answer is by chemical and mechanical bond. Quartz in the dental porcelain is act as, answer is strengthener. Super abrasive is, answer is diamond. Ceramic to metal are processed by, next MCQ is ceramics fired to metals are processed by, answer is sintering. Lithium disilicate, next MCQ, lithium disilicate contains crystal in the ceramic crowns are, answer is IPS Empress 2. Next question is, shrink free ceramic is known as, your answer is cerastone. Next MCQ, enamel is permeable to, your answer is peroxidase. Last MCQ, for air blasting of ceramic veneer, the particle size of the alumina is used are, your answer is 50 micrometer. So this is all about the MCQ. I hope it is clear to you. Let's discuss some more MCQs. So first is, porcelain denture teeth have a higher abrasion resistance than gold. Chemical tempering in porcelain is done to interrupt crack propagation by inducing residual compressive strength. Opacity in ceramics is achieved by, I've told you, titanium oxide. Machinable ceramic, glass ceramic is your decor MGC, I've already told you. Dental porcelain are crystalline material of your glass. In method of firing is, a large time period at the lower temperature is preferred. Chemical method of strengthening porcelain involves your exchange of sodium and potassium ion. I've told you that the potassium are larger and sodium ions are smaller. Dispersion of crystalline phase to strengthen ceramic results the aluminium porcelain. When the porcelain is baked against metal, it should possess, your answer is linear coefficient of thermal expansion less than but close to that of the metal. Next question. The three types of abrasive used in the dentistry can be classified as following except your bleaching agent, your bleaching abrasives. Coming on to the next question. Porcelain bonded to metal is strong when it is tempered after firing. Next question. Major drawback of porcelain is, as you all know, brittleness. So this is all about your dental ceramics. So in this you can expect at least 2 questions from this topic. It is a very vast topic and very important also. So please go through these slides once. These are very important. Thank you.